Make sure you have your sound turned on. So Medicare is made up of two parts, Medicare Part A and Medicare Part B. Now Medicare Part A will cover hospital stays, skilled nursing stays, and blood if you need pints of blood while you're in the hospital. And Medicare Part B will cover everything else. Doctor's office visits, x-rays, CAT scans, lab work, and durable medical equipment like wheelchairs or oxygen. So what does Medicare cost you? Now, most Americans, Medicare Part A comes in at $0 per month. Medicare Part B, though, will cost you $135.50 every month. So what doesn't Medicare cover? Now, Medicare Part A doesn't cover hospital deductible. Okay, if you get admitted to the hospital, you pay $1,364. Now, if you've read any of the material that you're probably buried under, you will see that it is a 60-day deductible. Now, what does that mean? If you get admitted to the hospital even overnight, you owe the first $1,364. Now, if you get discharged and then you're unfortunate enough to end up back in that hospital 61 or more days later, you have to pay that $1,364 again. Also is skilled nursing facility. Let's say you had a knee replacement and you had to go from hospital to skilled nursing for some rehab. Medicare A will cover the first 20 days. If you need more, Medicare can authorize an additional 80 days. Someone can have a total of 100 days in a skilled nursing facility. But on days 21 through 100, they want you to pay $170.50 every day. So if you add that up, that's close to $14,000 that you would be responsible for. Pints of blood while you're in the hospital. Medicare would like you to pay for the first 3 pints. Now, if you're like me and most sane Americans, you are now thinking, what's the big deal? How much can it be? It's donated. Well, I've seen one claim for 2 pints of blood, and it was close to $6,000. I kid you not. Medicare Part B, they have a yearly deductible. It's $185. That is not set in stone. Last year it was $183, so it can change yearly. So once you meet the yearly deductible, Medicare is an 80-20 policy. Medicare will pay 80%. They expect you to pay 20%. And that's it. That's how Medicare works. That's Medicare in a nutshell. But you're thinking, wait a second, I don't want to have to pay everything that Medicare doesn't cover. I mean, you could end up in the poorhouse if that happens. So there are 2 different types of insurance that you can pick from. I want you to imagine a big empty room. Divide that bad boy down the center. You get to choose which side of the room you're going to be on. You can only pick one, okay? On one side of the room, I'm going to put Medicare. Medicare is the boss. With Medicare as the boss, there's no network. You can go anywhere in the country. You can see anyone you want to see. As long as they take Medicare, you can go there. There's no pre-certification or pre-authorization. So if your doctor tells you you need to have a surgery, you don't have to contact any insurance company to get the okay. You just go get it done. Now, remember, we just learned what Medicare doesn't cover, okay? So with Medicare on the side of the room, I'm going to put a Medicare supplement plan. Sometimes these are called Medigap policies. Now, supplement, Medigap, I don't care what you call them, they're the exact same thing, just a different word. There are 8 to 10 different Medicare supplement plans on the market today. Now, just to make things more confusing for you, they don't have names. They have letters. Gonna make you want to cry. The letters are A, B, C, F, G, K, L, and N. The three most popular plans in the country are Plan F, G, and N. These plans will pick up what Medicare A and B leave behind to different degrees depending on which plan you pick. Okay, they also cost a different monthly premium. Now, neither Medicare nor a supplement plan will cover prescription drugs. That's called Medicare Part D. D for drugs is how I always remembered it. Now, even though it's called Medicare Part D, Medicare does not sell it. Medicare just sets the crazy rules that every company that does sell it has to follow. Now, you don't have to have your supplement plan and your drug plan through the same company. There are basically 25 to 27 different drug plans available in any given zip code. The way to pick a drug plan is based off of your medications. Any good agent will be able to enter your medications into a tool and be able to tell you which plan is the best plan for your specific medications. Never try to pick a plan that's going to work for you down the road. The reason, every insurance company can change their formularies. Now, formulary is just a big fancy name for the medications that they cover. So pick the best plan that works for you now, and then every year send a list of your medications to your agent and have them check to make sure that your current plan is going to work for you in the following year. And if it doesn't, then you can change your drug plan. So that's it. On half the room, we're going to have Medicare, a supplement or Medigap policy, and a prescription drug plan. They're all hanging out at that side of the room, and it's like a big party. Now, let's scoot over to the other side of the room. Even though you have to continue to pay for your Medicare, Medicare is going to leave the room. This company is going to take over as your primary insurer. These plans have many different names, okay, just to make you even more confused. They are called Medicare Advantage plans, Medicare Complete plans, Medicare Replacement plans, or even Medicare Part C. Potato, potato. I don't care what you call these plans. They all work basically the same way. I'm going to call them a Medicare Advantage plan. So if you choose a Medicare Advantage plan, the first thing that happens is you'll probably have an HMO or a PPO, which means you'll have to see network doctors. You may need referrals to see a specialist. You'll typically need pre-certification and pre-authorization for services. So if your doctor says you need a surgery, you have to get the insurance company's okay before you can get that surgery done. These are also the plans that you've probably seen advertised on TV. They may include a teeth cleaning, like, okay, you get your teeth cleaned once or twice a year, routine eye exams, gym membership, and maybe even rides to a doctor. Now, typically, these plans are $0 per month. Okay, but you know, and I know, nothing in life is free. So the way you pay for an Advantage plan is you will contribute to the cost of your care. So yes, you're going to have co-payments, okay? Co-payments and co-insurance. Whenever you go to the doctor and specialist, that's pretty typical. But you're also going to have a co-payment if you have an ambulance ride. Maybe you owe $300 for an ambulance. You'll have to pay so much per day for every day you're in the hospital. Maybe you have to pay $300 a day for the first 7 days. So $2,100 bill right there. You might have to pay hundreds of dollars for a surgery or even 20%. And typically you'll have to pay 20% towards chemo. So I always tell my clients, you get to pick your poison. You can pick a Medicare supplement plan, a drug plan, and have Medicare and know exactly what you're going to pay out of your pocket every month. Or you can pick an Advantage plan and pay $0 per month and pay as you use the services. Now you're going to have to look into your crystal ball. for the future, because it's really a good idea to try to pick a plan that's going to work for you for the rest of your life in case. The reason Medicare supplement plans have health questions outside of being brand new to Medicare, okay? When you're brand new to Medicare, I call that your get out of jail free card. You can pick any insurance anywhere without any health questions. But that's not true down the road. Say, Medicare supplement plans will have health questions. Medicare Advantage plans typically do not have health questions. So if you start out with Medicare, a supplement, and a drug plan, and then decide that you want to drop it, and then pick up a Medicare Advantage plan, you can do that, because remember, the Advantage plan does not have health questions. You can only join it once a year, but you can go from one to the other with typically no problems. But if you have a Medicare Advantage plan and then decide that you want to, like maybe you had a bad year and you want to go over to a Medicare supplement plan, you can't necessarily do that. Because remember what I said earlier, unless you're brand new to Medicare, Medicare supplement plans have medical questions. So if you cannot pass their medical underwriting or medical questions, you will be denied. So you need to choose wisely. No pressure. If you need help with any of the process of Medicare, want to know how to sign up for Medicare and Social Security, I'm here to help. My name is Melissa. I can be emailed, melissa@medicarewithouttears.com. You see my phone number right here on the screen. I am licensed in your state. I represent over 30 different companies. I have all of the plans that we talked about today, the supplements, the Advantage. I have the drug plans, vision and dental plans, and also life insurance. So give me a call, message me here on Facebook, email me, whatever you need to do. I promise I will try to make this as easy as possible for you. Thanks for listening. I hope you enjoyed this.